something really simple. Wherever you are, just take a slow, quiet breath in and out through your nose. Feels automatic, doesn't it? We do it, about 20,000 times a day without a second thought. But hidden in that simple action, there's this really deep chemical system running things. And if that system gets just a little bit off balance, well, that could be the real reason behind some incredibly confusing symptoms. Chronic fatigue, anxiety that just doesn't add up, weird busyness, or that constant feeling of being kind of unsteady, maybe wobbly. So let's unpack that chemistry. Today, we're doing a deep dive into carbon dioxide, KO-ROS. Now, we usually hear about KO-ROS as like the bad guy for the environment, right? Something to get rid of. But inside your body, it's absolutely vital. It's this quiet regulator of your balance. It's the key to actually getting oxygen delivered where it needs to go. And it's crucial for keeping your nervous system calm.
Exactly. And I think for listeners who've been, trying to find that link, that physiological reason for feeling unstable or just generally off, understanding KO-ROS, that really could be the missing piece. We're going to look at physiology that honestly is taught in the first year of med school, but somehow it rarely gets explained clearly to patients experiencing these exact issues.
Yeah, it's time we really challenge that villain idea for KO-ROS inside the body. We all know oxygen is the hero. We need it, obviously. But the science, well, it shows oxygen can't really do its job properly on its own. It needs a partner.
And that partner is KO-ROS. It's counterintuitive because we think breathing is all about purging KO-ROS, just getting rid of it. But that completely misses its actual function, its chemical role after you inhale. And the really fascinating thing here, the part that sort of changes everything about how you view breathing, is something called the Bohr Effect.
The Bohr Effect. Okay, that sounds a bit technical. Can you break that down for us? What exactly is it, and why is it so important for, well, just feeling normal?
Yeah, simply put, the Bohr Effect describes how KO-ROS acts as the trigger, you could say the unlock mechanism, that allows oxygen to actually detach from the hemoglobin in your red blood cells.
Yeah.
See, without enough KO-ROS present in the tissues, that oxygen just stays kind of locked onto the hemoglobin. You can breathe in tons of oxygen, fill your lungs right up, but if your CO level isn't in that specific, quite narrow sweet spot, then the oxygen doesn't get released effectively into your muscles, your brain, or, crucially for balance, the inner ear.
Wait, hang on. That's huge. So are you saying if I breathe too fast or maybe too shallowly and I blow off too much KO-ROS, I could actually be making my body less oxygenated at the tissue level, even if I'm breathing more air?
That's precisely it.
The oxygen stays trapped in my blood.
It's like having a full tank of gas but no key for the ignition.
Right.
Low KO-ROS is like losing that key. And think about where that oxygen needs to go, your brain for thinking, your muscles for moving, and yeah, the inner ear and cerebellum, which are basically balance headquarters.
Wow. Okay, so when cocoa dips too low, below that sweet spot, the body reacts immediately. It doesn't just wait.
Oh, absolutely not. It's an immediate chemical cascade. Physiologically, low KO-ROS causes vasoconstriction. Those tiny blood vessels, especially the ones going to your brain, they literally tighten up.
Okay.
Your nerves also become more excitable, more irritable. They fire off signals too easily. Muscles tend to tense up. And your nervous system reads this whole chemical picture as a threat signal.
It sounds exactly like those vague things people complain about. Feeling jumpy or having tight shoulders all the time or feeling floaty or off. But the cause might not be stress or posture. It could actually be these chemical alarm bells from low CA.
That's very often the case. It's this immediate body-wide chemical reaction that puts you in a sort of low-grade over-alert state. And yeah, it gets easily confused with things like generalized anxiety or just, getting older.
Which leads us right to the hidden trigger. Overbreathing. And we're not necessarily talking about full-blown hyperventilation here, right?
No, not at all. More often, it's these common, almost invisible modern habits, things that just make us breathe a bit faster, a bit shallower, a bit more urgently than we actually need to. And we constantly blow off that vital KO-ROS without even realizing it.
Like what kind of habits?
Well, think about it. How much time do we spend staring at screens, often holding our breath or taking really shallow little sips of air? Or constant mouth breathing, maybe when we talk, or maybe when we exercise incorrectly. Even things like repetitive sighing when we're anxious. And a big one, maybe the most damaging, happens at night: snoring or any kind of sleep-disordered breathing. That rapidly depletes KO-ROS while you're supposed to be resting and restoring.
So if the body is losing KO-ROS through these faster, maybe shallower breaths, why does the nervous system freak out? Why does just, say, staring intensely at my phone potentially shift my body into alarm mode?
Because your body runs on ancient survival chemistry. Falling KO levels, historically, meant one of two things. Either you were exerting yourself massively, like running from danger and using up oxygen rapidly, or you were in physiological distress. So the nervous system doesn't know you're just checking emails. It senses falling Q arrows and instantly shifts gears from rest and digest towards fight or flight. Chemically, it thinks it's starving for oxygen, paradoxically, even if you're actually breathing too much air volume.
Okay, this makes the choice of how we breathe even more critical. Which brings us to airway selection, nose versus mouth.
Absolutely fundamental. Think of them as two different tools for different jobs. Your nose. That's the calm, efficient strategist. It's designed for normal, everyday breathing, for preserving resources.
And the mouth.
The mouth is the emergency bypass. It's for eating, talking, shouting, and yes, for those very rare short bursts of extreme exertion like escaping danger. It's not meant for baseline breathing.
And the defense and function is huge, isn't it? Nose breathing is all about preserving QRO.
Yes, it naturally slows the airflow down. It creates a bit of resistance, which helps stabilize QRO levels.
Yeah.
But it does more than that. It also warms the air, humidifies it, filters it,
Right.
and importantly, it triggers the production of nitric oxide right there in the sinuses.
Nitric oxide, I've heard about that. What's the benefit there?
Well, nitric oxide is amazing stuff. It's naturally antimicrobial, which is great for defense, but critically, it's a potent vasodilator. It tells your blood vessels to relax and open up.
Ah, I see. So nose breathing doesn't just help you keep the QRO you need for the Bohr effect to release oxygen.
Exactly.
It also helps widen the roads for that oxygen to travel through.
Precisely. It optimizes the whole delivery system. Whereas mouth breathing, well, it does the opposite chemically.
It dumps QO fast.
Dumps QA rapidly, yes.
Yeah.
It also dries out your throat and airways, making them more vulnerable. And crucially, it sends that immediate stress signal we talked about, contributing to that irritable, slightly on-edge nervous system state.
So the takeaway is pretty clear. Nose for breathing, mouth for eating, and emergencies.
That's the fundamental design. Use the right tool for the job.
Okay, now let's connect this chemistry directly to physical stability, especially as we age. We need to talk about the clinical impact of having chronically low QO tolerance on balance, that feeling of wobbliness and the risk of falls. Because good balance is it's everything as we get older.
It really is. And the data links low QO tolerance very clearly to instability. Remember the vasoconstriction, tighter blood vessels.
Yeah.
Well, that means reduced blood flow to the key balance centers in the brain. It also means your reflexes can slow down. And it definitely increases that sensation of dizziness or lightheadedness, especially with quick movements.
Like turning your head quickly or standing up from a chair.
Exactly those kinds of things. Things that shouldn't normally cause a problem.
That makes so much sense. Because often, if an older person feels dizzy standing up or wobbly turning their head, the first thought is, oh, it's my inner ear, or maybe my leg muscles are getting weak.
Right, we tend to look for a mechanical fault.
But what you're saying is the root issue might actually be upstream. It might be the breathing chemistry that's off, preventing the brain and nervous system from coordinating balance properly in the first place.
That's often the underlying overlooked factor. We're treating the symptom, the dizziness, the unsteady gait, without addressing the chemical foundation. If the chemistry is off, the whole system struggles to maintain stability, and yeah, that significantly bumps up the risk of falling.
This is actually really empowering. But okay, how can someone listening right now get a sense of their own QO tolerance? We can't all run off to a physiology lab.
No, absolutely not. Thankfully, there's a really simple, reliable way to estimate it at home. It's called the Bohr T-score, that stands for Body Oxygen Level Test. It's not about performance, just a measure of your body's sensitivity to QO buildup.
Okay, the Bohr T-score. Let's be really clear on how to do this, because you said it's not a competition, right? It's about finding your current comfort zone.
Exactly. Precision is key here for an accurate reading. So, step 1, just sit comfortably upright. Breathe gently, normally, only through your nose for maybe a minute or two. Just let your system settle, no big breaths.
Okay, calm, normal nose breathing. Got it.
Step 2, take a completely normal, quiet breath in through your nose, and then a normal, quiet breath out through your nose.
Normal inhale, normal exhale. Check.
Step 3, right after you finish that normal exhale, gently pinch your nose closed with your fingers so no air can get in or out.
Pinch after the exhale. Okay.
Step 4, immediately start counting the seconds. 1, 2, 3, and so on.
Right.
Now, step 5 is the most important part. You stop counting at the very first distinct feeling that you want to breathe. Not when you're desperate, not when your diaphragm is spasming. It's subtle. Look for the earliest signal, maybe a slight tightening in your throat, an urge to swallow, maybe your diaphragm just gives a tiny little involuntary twitch, that first definite "I'd like some air now" feeling.
So don't push through discomfort. Stop at the first sign.
Precisely. That first sign is the chemical alarm bell ringing softly. That's your score. Step 6. Let go of your nose and just breathe normally through it.
And step 7.
Your recovery breath, the first breath you take after letting go, should be completely calm and normal. If you feel like you have to gasp or take a big, deep, compensatory breath, you held on too long past that first urge. Try again later, aiming for that earlier signal.
Okay, that makes sense. So what does the seconds we counted, actually tell us about our internal chemistry?
Well, a low Bolt score, let's say under 20 seconds, maybe 15 or even 10 for some people, indicates a high sensitivity to CoRO. It means those chemical alarm bells go off really early. This suggests you likely have a faster, perhaps shallower, baseline breathing pattern day to day. And it correlates strongly with those symptoms we discussed, the tendency towards vasoconstriction, nerve irritability, maybe anxiety, and poorer balance reactions.
And if someone scores higher, say 30 seconds or 40 or even more?
A higher score indicates much better CoO tolerance, much calmer internal chemistry. It means your body doesn't perceive rising CoO as an immediate threat. This generally translates to more efficient oxygen delivery via the Bohr effect, more relaxed blood vessels, a quieter nervous system, and typically, yes, much steadier reflexes and balance. It's why you often see athletes or people who practice mindful breathing like yogis scoring quite high. They've effectively, often unintentionally, trained their chemistry.
That's really encouraging because it implies this isn't fixed. If someone gets a low score, they're not stuck with it. You said co-tolerance is trainable.
Highly trainable. And the great news is, improvement can happen relatively quickly with just gentle, consistent practice. You're essentially retraining your brain's respiratory center to be less reactive to CoO.
So what's the prescription? What's the simple, actionable thing listeners can start doing today to gently improve their score and their chemistry?
Okay, the most fundamental, powerful first step. Intentionally close your mouth when you're not eating or talking.
Just close your mouth? Simple enough? Then what?
Then focus on breathing quietly through your nose. The aim isn't deep breathing, it's actually light breathing. Try to make your breath so soft, so gentle, that, the old analogy, if you held a feather under your nose, it would barely move.
So less volume, more quietness through the nose. What about belly breathing? Should we be forcing big diaphragm movements?
That's a common misconception. You should allow your lower ribs or belly to move naturally and gently with the inhale, yes, but don't force it. The biggest mistake is trying too hard, taking big, relaxing breaths that actually just blow off more CoRs. Think soft, effortless, quiet nasal breathing. Even just doing that consciously for, say, 3 to 5 minutes, maybe twice a day, starts to gently nudge your background CoRs, levels up, and recalibrate your system.
That really brings everything together. The core message here seems to be that we've misunderstood carbon dioxide's role inside us. It's not the enemy in this context.
Not at all. It's the essential co-pilot for every oxygen molecule. It's the master regulator of your internal balance, both chemically and physically.
So, when your CoRO's tolerance is healthy, oxygen gets delivered better, blood vessels stay more open, balance improves, anxiety tends to lessen, even sleep can get better.
Absolutely.
Yeah.
And when CoO levels are chronically low because of those sneaky overbreathing habits, mouth breathing, shallow chest breathing, stress breathing, that's when those confusing, seemingly unrelated symptoms can creep in.
It really highlights that your breathing pattern isn't just automatic. It's one of the most powerful systems you can consciously influence. You can literally train your own chemistry, impacting your stability, your mood, your energy.
It's incredibly powerful. So the final thought, the practical advice really boils down to this. Close your mouth whenever possible. Trust your nose to do the job it was designed for. The rest is chemistry.
Understanding that chemistry really feels like the key to unlocking better balance in a calmer system. Close your mouth. Trust your nose. Fantastic advice.